Dr. Frank Lavecchio works in the ER at Valleywise Medical Center in Phoenix. He says his hospital is treating more coronavirus patients than at any other phase of the pandemic.
The positives are it's almost over. The negatives are it's going to be a tough haul for at least the next 90 days. I think we're going to be, at capacity, over capacity.
There are now more than 110,000 people in the U.S. hospitalized with coronavirus, an increase of about 60% from a month ago. Dr. Anthony Fauci warns that American life may not return to normal until late next year.
The vaccine right now is not a substitute for the normal standard public health measures of wearing a mask, keeping your distance.
Hey guys, welcome back to another today's video. In today's video, it's going to be a brand new political discussion based video talking about the current health issue that's going on in this country, that's going on and currently plaguing our country right now, which we may know to be COVID-19, because we're living through it right now with the whole mask mandates, the whole lockdowns, the social distancing guidelines, even some states not allowing huge amounts of gatherings because they're trying to decrease they're trying to decrease the spread of COVID. And I wanted to talk about this this issue for a while now, simply because this is something that's really affecting all of our lives, including mine. Simply because like right now, I'm actually going to college still. I'm actually still going to college, and I think the one thing that's really the one thing I really don't like that much is the whole online classes or online formats of things, and I actually like, to be honest, I like the whole in-person learning stuff. It's something, and it's really, and on these online is really affecting that, simply because the reason why I like in-person learning more than online classes, because I get to actually physically go to the college campus and I can interact better with others. I just like talking to people face to face and meeting the instructor face to face and getting to meet new people and interact with them, because I can spend when I'm waiting and doing my homework in the cafeteria or the library, I can actually interact with other students as well, while I'm waiting for my next class to start. And this is what's overall really affecting my life, and it's affecting other people as well, like other college students like me that are from the state of California. I understand. I completely understand these whole lockdowns and mandates, because we're trying to keep people safe, for one. And I think safety should be the number one thing that the government should do, because that's one of the fundamental roles of government, is to keep their citizens safe from anything, from terrorism, from crime, and most fundamentally, from a disease, from a deadly virus. I mean, and I do think the mask mandate and the lockdowns are in the COVID-19 social distancing guidelines, and limiting a lot of the gatherings is somewhat, actually is, in my opinion, lower, decreasing the spread of COVID-19. But it's, in my opinion, I still think that it has several problems to this. For one, with the lockdowns, I'm from California, for one, and California wants to lock down everything again, completely close down a lot of the businesses, and that's not good, to be honest. You're being not really business friendly. The state of California is not really being that much business friendly, because guess what? Now, if those businesses can't reopen again, that means they're going to go under, and that's not right at all, because they should have the opportunity to stay open, simply because simply because that should be their right to, and it's going to ruin, and a lot of these, and and right now these lockdowns are really hurting a lot of businesses that can't really reopen again, and it feels very, and I kind of feel very like I do have a lot of emotions and condolences for this, and that's why one of the reasons why I don't believe lockdowns are not necessary anymore. They're only doing it because of increasing COVID cases. Like, but first of all, cases, like if cases are going up, that just means they're testing more people. That's not mean it doesn't mean it's a bad thing at all. 100% a bad thing if cases are going up because they're just testing more people, and we're knowing how many people in our how many people or citizens in our population have have tested positive for COVID-19, and so we know who are the people that need to be quarantined to keep other people safe. And but going back to the whole lockdown thing, I 100% believe that that lockdown should not like that we shouldn't have a second lockdown again. Even in California, our goal, I think all the governor's goals all across the country should be focused on one fundamental principle, and that is reopening the economy and letting businesses to reopen again and letting them invest, letting them getting their business going again so they can start making making money and investing it more into the economy, which will lead us and as President Trump said it, lead us into the greatest economic comeback in the history of American history. Um, that should be the number one primary goal. And some people are saying, well, but we have to keep people safe. Yes, we do have to keep people safe. We can still have a slow process of reopening, but we shouldn't shut down anything. Shut down anything anymore. We have to start beginning the slow transition to returning somewhat back to normalcy again, and letting these smaller businesses, these mom and pop businesses, to reopen their stores and letting them and we're still going to make sure they somewhat follow social distancing guidelines, but giving them more, being a lot more business and pro business friendly on the economy overall, so they can have the chance to make money again, to follow the American dream, to follow their American dream, and also and giving them that opportunity to invest in our economy again, which will once again, and I'm going to repeat myself, lead us into the greatest economic comeback ever in American history. And even thanks to the hardworking Trump administration, and in other countries, we already have a vaccine that's already being redistributed. That's already being distributed all across the country. It's first going to healthcare workers at first, and this vaccine has been reported to be 95 or 94% effective, and overall, that goes to show that we don't have to have any more lockdowns anymore because we're going to have a vaccine that can help us curb that's going to help us eradicate COVID-19 from the face of the earth, and we can start somewhat coming back to normalcy again. We can start letting these businesses reopen again and um, letting them invest and just letting them invest in our economy, which will ultimately grow our economy even bigger than ever. It's going to add a lot more money to the U.S. economy, and so I so I think the one thing that needs to happen is the governors. Um, first of all, I think a comprehensive plan is one thing that we need to do to uh, fight this virus for one. But also we also need to be someone thinking about the economy and thinking about what are the hardships of what small businesses are going through, because there's some businesses that can't reopen because of the guidelines, and we need in some areas we need to curb back the COVID-19 guidelines, so giving these businesses the opportunity to reopen their stores, to reopen so they can start making money for their businesses. They can start supporting them. They can start supporting themselves again and investing in our economy once more. Um, but as well, we part of this plan, we still have to find ways to make other people to making sure that we're still keeping people safe, because I think we can still have the whole mask mandate stuff. And I know at some businesses like Walmart, we're keeping track of how many people come into our store, and there's a max limit of how many people can be in a store at a time, like 480, I believe. And we can do those type of things to keep people safe, and we can slowly transition all that out by following it step by step, so we can somewhat return to normalcy, because we already have a vaccine that's already being distributed across the country. It's first going to healthcare workers first, and as it slowly begins to slow transition to being distributed, that's where all the governors need to act and start beginning the slow process of reopening our economy overall, while in the meantime we still keep people safe, and we can still have the mask mandate. We shouldn't be too strict about that anymore, but we should keep telling people to follow somewhat of the social distancing guidelines, uh, and follow the social distancing guidelines and the mask man and telling them to wear masks when they're ever not when they ever approach someone, when they're not standing 6 feet, when they're standing in big crowds, to making sure that we are still trying to reduce the spread of COVID-19. And as well, um, in the words of President Trump, don't be afraid of COVID-19 at all, because we're gonna beat it at the end of the day, because we have the best doctors, we have the best scientists that that's going to defeat that's going to defeat this virus once and for deadly virus once and for all. Don't be afraid of it, because we're going to defeat it, and I truly believe that we're going to return to normal, to how things were before the virus. And we have to have hope, and making sure we're and making sure we're beginning the slow of uh, transition away from the lockdowns and starting to reopen our economy. So let me hear where you guys stand on the issue of COVID-19. Do you agree with what I said about everything that I talked about? And um, do you agree with me that we should start beginning the slow process of reopening our economy and having no more lockdowns anymore? But tell me your thoughts, and how we as a country should right now handle COVID-19 or this deadly virus. But don't forget to like and subscribe. And until next time, guys, this is the Young Centrist, and I am out.